Students, very good morning to all of you. Today I have to talk to you about endotracheal inhalations. So, an airway catheter inserted in the trachea during endotracheal intubations to assure efficiency of the upper airway and acts as an artificial airway through which the oxygen or medicine is inhaled. So, in the endotracheal inhalations, what happen? Patient take medications, oxygens through by the endotracheal intubation. तो एंडोट्राकियल इंटुबेशन माध्यम पेसेंट कौन करे ना ऑक्सीजन मेडिसिन्स आनेस्थेसिया नहीं थाए तो से जो एंडोट्राकियल इंटुबेशन माध्यम पेसेंट रिसीव करे ऑक्सीजन मेडिकेशंस आनेस्थेसिया रिसीव करे तो ये जो मेडिकेशन से मेडिकेशन जो रिसीव करे ताकू इनहालेशन माध्यम से मेडिकेशन गुड़े को नहीं थाए ओके मेडिकेशन को रिसीव करी थाए तेणु ताकू आम एंडोट्राकियल इनहालेशन कही था सो एंडोट्राकियल इनहालेशन it is endotracheal inhalation done through by the endotracheal intubations. So first you know that what is endotracheal intubations. Endotracheal intubations is a medical procedure in which tube is placed into windpipe, that is not trachea, through mouth or nose in order to keep the airway open and in order to give oxygen, medicine or anesthesia that support illness such as pneumonia, heart failure, collapsed lungs. ताले एंडोट्राकियल इंटुबेशन कौन ना एंडोट्राकियल इंटुबेशन हूँ गोटे मेडिकल प्रोसीजर जो थे कि गोटे कैथेटर ट्यूब आमर ट्राकिया बा विंड पाइप को अटैच कर ट्राकिया बा विंड पाइप को जाए एवं ये ट्यूबटा माउथ और नोज मध्यम ट्राकिया मध्य को एंट्री करता है इन मोस्ट इमरजेंसी सिचुएशन इट इज प्लेस्ड थ्रू द माउथ जब इमरजेंसी सिचुएशन होता है ताहले माउथ रे इंसर्ट करा देता है सो एंडोट्राकियल इंटुबेशन इज ए मेडिकल प्रोसीजर इन व्हिच ट्यूब इज प्लेस्ड इनटू द ट्राकिया और विंड पाइप थ्रू माउथ और नोज इन मोस्ट इमरजेंसी सिचुएशन इज प्लेस्ड थ्रू द माउथ and here we do the endotracheal intubations for keep the airway open in order to give oxygen, medications or anesthesia and that will be support to the illness such as pneumonia, heart failure, collapsed lungs. तो एंडोट्राकियल इंटुबेशन हूँ प्रोसीजर जो थे कि गोटे ट्यूब ट्राकिया मध्य माउथ और नोज मध्यम ट्राकिया को इनसर्ट करा जाए ट्राकिया मध्य को एंट्री करा जाए एवं कहीं करा जाए ना आम एयरवे को क्लीयरेंस करने ऑब्स्टैकल को रिमूव करने एवं जहाँद्वारा कि ऑक्सीजन मेडिसिन एवं एनेस्थेसिया पेसेंट ट्राकिया मध्यम लंग्स को दिया जाता है सो ऑक्सीजन मेडिसिन एनेस्थेसिया पेसेंट रिसीव करी थाए जेहेतु एयरवेटा क्लीयरेंस हो रही है whether you are awake that is conscious or not awake unconscious you will be given medicine to make it easier and more comfortable to insert the tube you may also get relax so when either the patient is conscious or not conscious or unconscious but after giving the medications that will be easy for the patient and it is make easier for the patient more comfortable to the patient because through the tube it will be inhaled the medication inhaled so endotracheal inhalation कहले माने आम एंडोट्राकियल इंटुबेशन माध्यम जो ट्यूबटा ट्राकिया मध्य को इंसर्ट करा जाए हाँ इट इज ए मेडिकल प्रोसीजर इन व्हिच द ट्यूब इज इंसर्ट टू द ट्राकिया थ्रू बाय द नोज और माउथ in order to keep open the airway and in order to give medications, oxygens and the anesthesia to the patient ताहले एंडोट्राकियल इंटुबेशन हूँ गोटे प्रोसीजर मेडिकल प्रोसीजर जो थे कि गोटे ट्यूबटा नोज माउथ मध्यम ट्राकिया को इंसर्ट करा जाए ट्राकिया को जाए एवं से ट्यूब मध्यम पेसेंट कौन करे मेडिसिन ऑक्सीजन एनेस्थेसिया इत्यादि रिसीव करी थाए ताको आम तो मेडिसिन रिसीव करी थाए से आम एंडोट्राकियल से प्रोसीजर को एंडोट्राकियल इनहेलेशन कही थाउ एथरे एयरवे कौन पूरा क्लीयर हो जाए थाए ओके then what is the purpose of the endotracheal inhalations here endotracheal inhalation is done keep the airway open in order to give oxygen, medication, anesthesia and to give halogen gases during surgery through by the endotracheal inhalation or endotracheal intubation procedure. তাহলে এন্ডোট্রাকিয়াল ইনহেলেশন মাধ্যমে কোণ হুଏ না পেসেন্টକୁ মেডিকেସନ୍ସ অକ୍ସିଜେନ୍ ଦିଆଯାଇଥାଏ ଏବଂ ଏଣ୍ଡୋଟ୍ରାକିଆଲ ଇନହେଲେସନ୍ ମାଧ୍ୟମରେ ପେସେଣ୍ଟ ହାଲୋଜେନ୍ ଗ୍ୟାସ୍ ମଧ୍ୟ ସର୍ଜରୀ ସମୟରେ ୟୁଜ୍ କରିଥାଏ and also to administer medication during an emergency through the endotracheal tube include epinephrine, atropine, lignocaine. তাহলে ইমর্জেন্সি সমୟରେ ଯେଉଁ ଏଣ୍ଡୋଟ୍ରାକିଆଲ ଟ୍ୟୁବ୍ ମାଧ୍ୟମରେ ମେଡ଼ିକେସନ୍ ଗୁଡ଼ା ମଧ୍ୟ ପେସେଣ୍ଟ ରିସିଭ୍ କରିଥାଏ ଯଥା ଏପିନେଫ୍ରିନ୍, ଆଟ୍ରୋପିନ୍ ଆଣ୍ଡ ଲିଗ୍ନୋକେନ୍. Then come to the equipment. So equipments is same like the endotracheal intubations. Like you take the oral tracheal tube. If in emergency situations, the tube will insert through by the oral, and it goes to the it will be goes to the trachea. And also nasotracheal tube will also be endotracheal both orotracheal tube and nasotracheal tubes is also be necessary for the patient who are in the endotracheal intubation procedures. So tube will insert through by the oral as well as the nasal. So equipment like the tube, we take the endotracheal tube or catheter tube. The size of tube is size of tube if the infant if in infant case year about 0 to 1 years we take to 2.5 to 3.5 millimeter, and if the child's year is about 1 to 3 years then we take 4 to 5 mm. If the year is between 4 to 6 years you take the 5 to 6 millimeter tube, and if the child is in case of the 6 to 10 years you take the 6 to 7 mm, that is the cupped. In case of adult female we take the 7 to 8 mm and endotracheal tube. In case of adult male patient we take the size of tube should be 8 to 9 mm. And another equipment like we take the laryngoscope. See that is the laryngoscope for the visualization of the vocal cord or larynx or the trachea, upper airway during the inserting of the endotracheal tube. Then we take the McGill's forceps. McGill's forceps is helpful for the guide of tracheal tube into the larynx, and it is help for the inserting of the tube which goes to the esophagus. Okay. Then we take the stethoscope for the hearing of the sound. Then we take the suction machines for the if any type of secretion is there to remove it. Okay, and also take the source of ventilation like mechanical ventilator is not there, but take, and we take the syringe to inflate the cuff. We take syringe for the always cuff is deflated for inflating the cuff. We take the syringe. So it will also be confirmed to us that is a tube is fitted to the throat and a tube is properly inserted. So orotracheal tube or nasotracheal tube will be taken, orotracheal tube or nasotracheal tube or endotracheal tube for adult are always most preferable because it is cupped, prevent the air aspiration of a leakage, and also allow for their use with a mechanical ventilator. So tube also be the endotracheal tube is attached with the mechanical ventilators by which air will be passes from the mechanical ventilator through by the endotracheal tube to the trachea or the airway lungs. but pediatric tubes are not cupped since the airway is narrower at the distal end. Then come to the procedure. First, we saw that during the endotracheal intubations, what is the procedures? Okay, so before the procedures, before the procedures of the endotracheal intubations or the endotracheal inhalations, so always the room should be in the preliminary assessment, room should be well ventilated, or it is not overcrowding, but it is very closed. Okay, and hand wash should be done, and maintain the sterilized technique, and maintain the aseptic technique in the unit, and also explain the procedure and detail to the patient to win the confidence, provide privacy if needed. Okay, and all the articles should be remains in the patient side. So during the endotracheal intubations, first we discuss about the endotracheal intubation procedure, then to the endotracheal inhalations procedures, because endotracheal intubation procedures, if we discuss about the endotracheal intubation procedure, under it the endotracheal inhalation procedure is also same, because in the endotracheal intubation, after inserting the tube, through the tube, medications or oxygen should be taken by the patient, and that is the same like the, and that is the endotracheal inhalations. So in the endotracheal intubation procedure, जो ट्यूब इंसर्ट कला परे पेशेंट जो मेडिकेशंस ऑक्सीजन रिसीव करता है, तो से जो इनहेलेशन द्वारा जो मेडिकेशन रिसीव करे सेटा हूँ आमर एंडोट्रेकियल इनहेलेशन अटे है। तो एंडोट्रेकियल इंटुबेशन प्रोसीजर फास्ट कौन करवा, raise the patient head by 5 centimeter, then the extension the occipital joint of the patient, flexion and neck, ताले patient head को 5 centimeter उठेइबा तार से हेड पाखे इन ब्लॉक और रिंग पिलो दबा। ओके, तापर ऑसिपिटल जॉइंट जगह ऑसिपिटल पेशेंट ऑसिपिटल जॉइंट रीजन टाको एक्सटेंशन करवा जेपरिक से नेक टारे फ्लेक्शन हो पारथिबो। ओके, सो रेज द हेड बाय 5 centimeter, extension at the occipital joint, flexion at the neck, then take the laryngoscope. Already we see the saw to you about the diagram of the laryngoscopes, which is helpful for the visualization of the vocal cord or the airway of the trachea. So hold the laryngoscope with the left hand. So simultaneously when you hold the laryngoscope with the left hand, at that time through by the right hand open the patient mouth, and then introduce the laryngoscope from right angle of the mouth, then shift the tongue to the left, then go in, then press over the tongue, then see epiglottis, then watch vocal cord, then take tube right hand, then introduce under vision, and confirmation placement of the endotracheal tube by the auscultations. Okay, so again I have said that first patient head should be raised in the 5 centimeter, then extension of the occipital joint of the head, then flexion at the neck side, then hold the laryngoscope, which is helpful for the visualization of the vocal cord as well as the trachea or airway, and so that you should hold the laryngoscope with the left hand and simultaneously open the mouth of the patient by the right hand, then introduce the laryngoscope right angle of the mouth, then slip the tongue to the left side, then press over the tongue, then see the epiglottis, then watch the vocal cord, then confirmation placement by auscultation. So in the auscultation in the auscultation method, so you should confirm the placement. So in the auscultation method, what happen, you hear the sound through by the stethoscopes. If when you take the tube is cupped, if the tube has the cupped, then inflame the cup through by the syringe, Then connect the tube through the connect the source to the tube. Then how to confirm that tube is placed in the proper, through by the auscultation method, through by the hearing the sound by the stethoscope. If tube will be entered in the proper area, then it will be sound will be observed, sound will be heard, chest will be expand and the bag also movement. Then tube will be fixed with the adhesive tape. Then connection the tube also to the ventilation, ventilators, ambu bag, etc. So that in the endotracheal intubation procedures, we had seen that first extend the patient occipital joint. First patient head will be raised to the 5 cm. Then extension of the occipital joint. Then the hold the laryngoscope with the left hand, which is helpful for the visualize the vocal cord. Through by the right hand, you should open the mouth of the patient. And then tube will be inserted, and before the inserting on the tube, tongue should be turned to the left side and press over it. Then the localize the vocal cords. Then insert the take the right tube, take tube in the right hand, then introduce the tube. Okay, if tube has cupped, always see that tube has cupped. So that see that tube always has cupped, which is the deflated. After inserting through by the syringe, push some water. Then the if the see that if tube is cupped through by the syringe, the tube becomes inflated, and that is ensure that tube is properly inserted and it is fit with the throat. तो ट्यूब जो इनफ्लेटेड ट्यूब जोटा रही इनफ्लेटेड कप रही है डिफ्लेट अवस्था जो थ्रोट भर को देखिए आम भर को एंट्री करवा नोज बा थ्रोट मध्यम थ्रो भितर देखिए गलापर आम सिरिंज मध्यम किसी वाटर पुश कर इनफ्लेट कर वाटर तो दे न था से सिरिंज मध्यम से कौन कर ना एयर पुश कलापर से इनफ्लेट हो जाए. ओके, if tube is cupped, then inflate the cup with the syringe मध्य इनफ्लेट करदे जी कि से थ्रोट रे कहीं जो ना फिक्स होकर रही है. देन कनेक्ट द ट्यूब विथ द सोर्स. आम केमती जाना जे एंडोट्रैकियल ट्यूबटा ठीक भाव में इनसर्ट होली ना जो देखिए ऑस्कुलेशन मेथड जो स्टेथोस्कोप द्वारा शुणा जे किसी साउंड आसुची. ओके, आ चेस्ट मध्य एक्सपांशन होची देखिबा एवं ट्यूब को आधेसिव टेप माध्यम फिक्स करदे एवं ट्यूब को मध्य वेंटिलेशन मेकानिकल वेंटिलेशन सहित अटैच करदे जहाँफल कि ऑक्सीजन जेकोसी मेडिसिन देता से ट्यूब माध्यम पेशेंट बॉडी को एंट्री होता है. ट्राके माध्यम लंग्स मध्यम को ट्राके मध्य लंग्स मध्य जाता है. ओके, then come to the nebulization therapy. So first you know that we have to confirm that nebulization is a procedure in which medications delivered to the patient through by the nose, and it transport to the lungs. So nebulization is the procedure in which medications enter in the moist form into the lungs. That is nebulization. What is the nebulizer? Nebulizer machine by which medications are converted to the mist form or mist solutions, and that is goes to the lungs. So it is a nebulizer therapy. It is a process. What is the nebulizer therapy? The definition of it is a process of preparing medication solutions medical solutions are converted to the mixed form of solutions in the nebulizer, and by which the compressed air oxygen it goes to the lungs in the moisture form, which is the relief from the bronchospasm, or the it provide the oxygen lack of, if the patient has lack of oxygen also the nebulization therapy is given. What is the purpose of the nebulization therapy? For the losing of the secretions, patient make easy breathe and also improve the respiratory functions. What are the equipments taken? We take the pulmoid for the check the functioning, oxygen source will taken, tubing and nebulizer machines are taken, face mask with tubing and nebulizer also taken, medicines also take, and medication cards, sterile normal saline 0.9% taken, stethoscope also be bring, and sputum cup rag pieces also be bring. See that picture, it is a if you take the nebulization through by the machines, so the we take the nebulizer and with the compressor and the tubing. Okay, see that in picture. If you take the nebulizations therapy, you take the medications through by the nebulization procedure through by the mask. Here the mask is there and tube is attached, and the medicine cup also is attached with the from the mask. तो mask देखो यदि आम मेसीन द्वारा नौचे, जदि आम नेबुलाइजेशन पेशेंट नेबुलाइजेशन तो मेसीन द्वारा दूचे, ये कंप्रेसर रोचे, नेबुलाइजर रोचे, ट्यूब अटैच होची. ओके, तो नेबुलाइजर रे ये कौन हो, नेबुलाइजर माउथ पीस रही द्वारा कौन हो ना पेशेंटर माउथ द्वारा माउथ रे कौन हो मेडिकेशन गुड़ाक लंग्स को जापरुच्छे. ओके, so from the mouthpiece of the nebulizer, medications are in the mixed form medications go through the mouth to the lungs of the plant, by which patient receive the medications. See that picture, that is the medicine cup is there, mouthpiece there, and nebulizer there, face mask of the adult, it is the face mask adult. So here the always patients wear the face mask. In the face mask also, face mask is attached to the mouthpiece of the nebulizer, that nebulizer is attached to the compressor. So from the nebulizer, medications enter through the face mask to the through the mouth, and it goes to the lungs. See that is the mask, it is the tube, it is medicine cup. So when we attach the face mask to the patient's face, it is tightly fitted to the nose and mouth, and the tube is attached to the compressor or oxygen source, and here the medicine cap is there, which is attached to the medicine cup there, which is attached to the face mask. See that in the lower part of the face mask, medicine cup is attached. Here the medication also given, and that medications is converted to the vaporization form or mist form through by the face mask. It goes to the lungs of the patient, and the tube is attached to the oxygen sources through by the oxygens into the medicine cup. Then in the medicine cup, that is the medications are converted to the mist form through by the face mask. It goes to the goes through the mouth to in the mouth and nose to the so medications from the face mask goes to the nose, goes mouth and nose. From mouth nose it goes to the lungs, where patients receive the medications and proper breathe. See that picture, a diagram. So procedure first assess the patient conditions and the respiration status of the child, then collect all equipments, and clean the patient face mask, check the medicine card with medicine card according to the doctor's order, check the nurse's record, and explain all the procedure to the patient. Then give the position to the child. If patient is infant, ask mother hold the child with rising up of the head, with resting on the elbow. So if infant, then the patient is infant, then we cannot say any influence to the infant. We ask to the mother to hold the child up with the head and resting on elbow. Resting on elbow. तो जदि इनफेंट होता है तो माँ को कह क्लाएंट को भल भाव चाइल्ड को भल भाव धरब और तार हेडटा एल्बो पर हेडटा एल्बो पर रहा कौन हुए एल्बो पर जदि हेडटा सुपाइन पोजिशन हो ताले फेस मास्कटा टोटल स्ट्रांगली फिटेड होइके रही पार फेस आउ फेस नोज माउथ सहित जहाँफल कि प्रॉपर मेडिकेशन गुड़ाक थ्रू बाय नोज एंड माउथ इट गोज टू द लंग्स. If preschooler, then ask mother to hold the child up and elevate the head also. If in case older children, give the child to the semi-flower position and also given pillow under the head. Then instill the right amount of medications according to by the calculation according to the physician's order. Proper amount of medications will be installed. Then in the nebulizer, add a normal saline. So nebulizer add the normal saline in the nebulizer machine. Check the child's respiratory rate. Plug the pulmonary and put on switch check for the fumes. So that in the first terminal 11 plug the pulmonary and put on switch and check for the fumes. So ठीक कौन हो फास्ट 10 नंबर स्टेप रे चाइल्ड रेस्पिरेटरी रेट केते रही जानिबा तापर स्टेप 11 रे पल्मोनरी को प्लग करिबा एंड स्विच को ऑन करिबा एवं फ्यूमस फॉर्मेशन होछि नै ता चेक करिबा. Then apply face mask which is strongly fitted to the child face. Then also be step number 13 check the respiratory rate as well as the pulse rate. And in the step number 14 administer the solutions in the nebulizers machines which is the fitted in the face mask. Then the at the time divert the child's attention. Then the pulmonary should be put up and then the step number 7 face mask should be removed and give reassurance to the mother as well as the child. Then the give the chest physiotherapy if it is required. Then the reassess the child condition if the child is having the breathing difficulty and the respiration difficulty like the ronchi or any produce the wheezing sound or whisper sound. Then the step number 20 then make the child comfortable. After the we ensure that the child receive the proper medications. Then the disconnect the nebulizer and face mask. Then the empty the respiratory solutions from the medicine cup which is attached to the face mask or the nebulizer machine which is strongly fitted to the face mask. Then the wash the nebulizer face mask tipping with the soap and water, and then the documentation the times of administration and in which time you given the medications, what type of drug, duration, dosage, all should be recorded.